Hello, my name is Matthew Irvin. I hold a PhD in sociology from North Carolina State University. In this slide presentation, I will discuss the links between sociology and human and social services and how sociological knowledge can contribute to a rigorous human services knowledge baseline. I will review what sociology is, the scope of human services, the goals of social science as science, and how sociology and its foci can contribute to human services. Toward the end of my presentation, I'll provide examples from my own research and some possible resources for you to access. So what is sociology? Simply put, it is a study of human social relationships and institutions. It is a study of social life, social change, and the causes and consequences of human behavior. Human services professionals may work on prevention, remediation, or both, and further seek to improve accessibility of basic needs, from mental health care to shelter. Human services often focus on broad community-based work such as coordinating services between agencies. So how do these disciplines inform each other? What can a baseline knowledge of sociological methods and theories do for the human services professional who is working with clients to improve their lives? To get at this question, let's first examine the basic scientific goals of social science. These are the goals of all social science endeavors. We describe a situation, a social pattern, with the goal of putting isolated incidents into a larger context. If, for example, there's an incidence of spousal abuse, a social scientist asks in a systematic way, what is unique to this incident? How is it similar to other incidences of spousal abuse? And what in the past has been done to enumerate similar instances? Sociology has tools, interviews, assessments of large-scale existing data, surveys, what's called the quasi-experimental method, to describe this incident in a larger social context and to draw on possible solutions that have worked in the past. This then is the evaluative aspect of sociology, from description through explanation and ultimately through the analysis of data to evaluation. The human services professional is a prescriber, step number 5 in the goals of science. Sociology typically only diagnoses. It does not provide lines of action. This is the function of the human services provider. The human services provider has the capacity to take this description, examine the context, and then at the critical inflection point of action, craft and implement a plan of action to enumerate the existing situation and to prevent further occurrences. So what are the techniques that we can draw on from sociology? There are 2 sets of techniques from the sociological tradition that can inform the explanatory and evaluative process, creating a framework through which the human services professional can craft and implement actionable steps to improve situations for both clients and groups. Social research methods, or how we know what we know. The first set of heuristics is social science research methods. While there are a plethora of different methods, I'll focus on these that are important for the work of human services. For the big picture, when the human services professional is implementing a policy-informed program, a description, survey of clients to identify pertinent needs, or what is termed the quasi-experimental method, where there is a particular program implemented and the clients are tested before and after undergoing a program, typically an educational program. These are used to provide a framework from which the human services professional can assess and evaluate either a definition of the problem in the case of a survey or the effectiveness of a program before and after implementation, a critical component in grant writing and funding for the implementation of programs and the resources necessary to do so. To get the details, to provide a detailed observation, the goal of descriptive research and a prelude to evaluation, we need to interview individuals to provide a detailed description that is not available through large-scale surveys or program evaluations. When applying this quasi-experimental method, we are conducting a pretest where we ask a set of specific questions to gain a baseline of responses. We implement the program, and then we administer the same or similar set of questions after the participants have completed the program. We then measure the differences to determine if they are statistically significant. That is, has the program affected the attitudes and knowledge of the participants? In a survey, questions are crafted and used to gain specific knowledge about an issue or problem relevant to the clients. In a guided interview, questions are open-ended and more detailed. Information on an individual is collected. In each of these techniques, question construction is imperative. I'll provide a list of resources at the end of the presentation that will provide useful information. The questions need to be unbiased, clear, and relevant to the respondents. Usually in the interview process, the interviewer can provide clarity. This is more of a problem in survey or evaluative or quasi-experimental data collection if the questions are not worded correctly at the onset of the project. It is sound policy, if possible, to conduct a beta test of survey or program questions with a small sample so that any potential language issues can be resolved prior to administration of data collection. It is also useful for the human services professional to have a broad baseline of knowledge of the three basic theoretical paradigms of sociology. Social problem students here at SNHU, many of whom are human service majors, frame their work on a specific social problem in terms of these theories. Keep in mind that a theory is basically a systematic narrative that explains some part of a social process in the social world. Structural functionalism begins with the premise that society is a series of interrelated parts. Dysfunction, then, comes from when some element of the working of these interrelated parts is disrupted. Human service professionals working with families, for example, may find it useful to identify the components of a family system that are working against the equilibrium of the family. Conflict theory holds that society is characterized by an unequal distribution of access to societal resources, sometimes resulting in conflict. Access to mental health resources, particularly after the pandemic, for women in communities of color, for example, has become a critical inflection point. Knowledge of these inequities may help the human services professional narrow their focus in order to identify and acquire services. Finally, the interactionist approach identifies how people create their reality through interactions with others effectively through language and symbols, building their social world at the individual level from the ground up. Knowledge of this could help the human services professional identify emerging issues through a dialogue with a client to find out the nature of a potential problem, how the client is viewing it through the lens of their personal experience and their narrative, and it can provide clarity at the individual level in terms of identification of pertinent resources. Finally, I'm going to draw on my own experience in working with human services professionals and to provide some examples. First, Eastern Kentucky University, EKU SAFE, was a program implemented in 2011 and was designed to create a campus culture where there is zero tolerance for sexual assault. Working with colleagues in a social work program, I took data that had been collected pre and prior to the implementation of a training program that was mandatory for all first-year students. The goal of the administration of the program was to change attitudes of all students about sexual assault to create effectively a new culture and what is considered to be acceptable behavior. I was tasked with conducting what is termed in statistics a paired samples t-test, where the responses are a dependent variable measured against the initial responses or the independent variable. I was tasked with conducting this statistical technique where the post-test, that is after the administration of the program, results were compared with responses before the administration of the program to determine if the change in responses had been significant. That is, if it had changed as a result of the administration of the program to the students and not due to chance alone. I conducted similar pre- and post-test analyses on programs designed to change the attitudes of absentee fathers in their involvement, both substantial and in terms of child support. The programs are educational programs designed to change the attitudes of the fathers towards their involvement with their children. In each of these program evaluations, the goal on my part was simply to assess significant changes and non-significant changes as well. The language in these assessments is in what's considered the presentation of data section of the write-up of this material is straightforward and direct. It is the task and the goal of the human service professionals, in this case social work faculty, to provide interpretation. The following are a list of resources that I have provided that I think are extremely useful in terms of applied social research methods, what it means to write a meaningful survey question, both in terms of interview and large-scale surveys, and a great and inexpensive and very popular methods book on understanding research methods. I've also provided a link to Maryville University's explanation of the role of sociology in human services and its subset, social services. Thank you very much for giving me this opportunity to present this material. If you have any questions, please do not hesitate to email me here at SNU. Have a wonderful day.